It is JJ and Kat, and we're hanging out with Dr. Brandon Raudenbush. How are you?
Very good, thank you.
Well, we were talking about pushing the snow around. We were talking about, having back pain. You specialize in patients a little bit older, patients over 40. It's very common, especially this time of the year. And, we were talking last week as well. The weather does play a factor in how you feel with certain injuries, to that area.
Certainly, yeah, definitely. So with the barometric pressures changing, the storms coming in and out, the joints of the spine and back are similar to just every other joint in your body. Knee, elbow, shoulder. They're synovial joints. It's a fancy medical term you don't need to know. But it's
but now we know it.
Now you know. But it's similar to the other joints of the body. So if you have knee pain or arthritis, you're going to get back pain as well. And it's very prevalent. 80 to 90% are the stats of people will experience some type of prolonged back period during their lifetime.
When it comes to the back pain, it can really lead to some serious health problems.
It can. So another factor that I tell everyone, especially in Ohio, is all of my patients, all of us are low in vitamin D. If you want to spend $100 to check the lab through your primary care doctor, you can do that, and you're going to find out that you're low. So I tell everyone 5,000 international units a day. I tell everyone to take that, because over time you can start to develop a loss of the curvature or an accentuation of the curvature of the upper back.
What?
And that can lead to problems.
Yeah.
So
When should we, what age do you recommend?
I have my 8 and 5-year-old on.
Really?
Oh yeah. We're all low, and we don't even understand all of the effects of low vitamin D yet. So as we're finding out more, it's affecting nervous system, pain, chronic pain problems, issues. I tell people if you have chronic back pain, physical therapy or staying active, core strengthening, and I put everyone on vitamin D.
Yeah, and you're seeing patients in Chardon, Mayfield, and Beechwood, and Ashtabula, and Ravenna, and everywhere in between. So just a lot of people, but it's a super common issue. But there's so many different things that can lead to it. You were talking about there's some spinal infection stuff that you've seen recently.
There is, and we don't understand patients. Some people are just more immunocompromised, meaning their immune systems aren't as healthy. They could have other chronic diseases or illness, diabetes. They could be smokers. We still have about 17% of our population that smokes, and by far, my patients probably 75% of them come in with back pain and they're smokers. So you can develop infections of the spine.
Crazy.
So yeah, it's scary stuff. So when to come see me for sure, it's if you've had more than a 6-week period of low back pain or any type of radiating pain, numbness, tingling down the legs. That's something you should get checked out.
Wonderful wealth of knowledge, of course, with the Cleveland Spine Specialist and Tri-Point Physicians Pavilion. Well, Brandon, don't be a stranger to the show. Thank you.
Thank you, guys.
We learned a lot. I'm going to go and get some extra sun in a bottle, if you will. And then if you want to get a hold of them, the phone number 1-844-774-6828.